get started now as people keep joining us. So welcome, my name is Stacy. I am a planning advisor with ECMO Steps Forward. I used to do subrecipient monitoring with contracts, so it's good to see some familiar faces or names. But before we jump in, I'm going to go over some general housekeeping and what we'll be covering today. Jody, can you go to the next slide, please? So today is part one of the training series. We're really happy you all are joining us. It is covering eligibility and documentation standards. We will be recording and you'll get a copy of this presentation afterwards. It will also be on our website. Next slide. So today is going to be presented in a webinar format. So that means that all participants are muted upon entry. We're only using computer audio for this presentation. And if you need any assistance or have questions, there's a Q&A feature. So please feel free to use that. We'll be answering questions along the way. We'll also have time at the end for some Q&A. Next slide, please. So today we're going to be covering program components, admission, eligibility criteria, definitions, record keeping, eligibility information, and termination and due process. Next slide. The objectives of today are really to understand eligibility criteria, including definitions of what's needed to document things like disability and chronic homelessness. We'll also go over the SSF project level termination, grievance, and appeal requirements. So if these don't necessarily, excuse me, apply to you, they could be useful because these types of policies apply to all recipients and subs of HUD CoC program projects. The goal of the whole training series is really to provide foundational training on everything projects need to know. So although this is geared towards our SSF recipients, it's valuable for recipients too. As an SSF, because SSF is a recipient, we are responsible for monitoring our subs at least annually, which we'll be covering more in part 3 of this training series. And we're also excited because we'll be releasing a accompanying manual within the next few weeks so that projects can refer to it with this information. I am joined by Melanie, who will be providing the majority of the training series. She is a HUD TA consultant with TAC, the Technical Assistance Collaborative. She's provided us with a couple of internal trainings, and we are very grateful to have her be able to share her expertise with us all. So please ask questions. We really want this to support you all. And I will be here supporting. If you have questions or feedback, please don't hesitate to put it in the chat or the Q&A. And with that, I will hand it over to Melanie.
Great. Thank you so much, Stacy. Good afternoon, everybody. My name is Melanie Mondello. As Stacy said, I work for Technical Assistance Collaborative. Most people just know us as TAC. We are a national technical assistance firm, and we're brought to you today by HUD funding to help, like Stacy said, just build some foundational aspects of the CoC program so that you can grow and thrive as a community and have really compliant programs. Before I came to TAC, I was on your side. I had 24, 25 projects, so I've been in your shoes. And I hope today to help in whatever way I can, demystify, teach you to speak HUD in this 90-minute session and the ones that follow. So thank you again for coming today. Please ask lots of questions. If there's a question that we can't answer because it's too detailed or very, very project specific, then definitely can follow up with Stacy, and then we can huddle and try and get you an answer that resolves that for you. So please send the questions our way. We will triage those and answer as many as we can during the session today. So as Stacy said, today we're going to talk about eligibility and then grievance, appeal, and due process. It's really important before we go into the eligibility of like what documents to gather from people to do a high level overview of the program components for CoC program. I'm assuming some of you have been doing this for years. Some of you may be very new to this role. So I'm going to go over the program components briefly. There's a lot more information on the slides. There's a lot more information on the HUD Exchange. So I am going to go fast through this first part so that we can get to the documentation piece of this. So Jody, if we can go next slide. So when thinking of the CoC program, they have different project types that they've outlined and that they'll fund each year during your annual competition. So one of the higher level categories that they designate is permanent housing. And permanent housing has two types, two styles under it that we'll talk about both. But permanent housing at its core is meant to be community-based housing, and permanent by its name reads no designated length of stay. So this housing model, people should be able to stay as long as they choose. There should not be any forced exits. HUD breaks permanent housing into two lanes. One is permanent supportive housing, which you'll hear called PSH. The other is rapid rehousing, which people call it RRH typically. In permanent housing, both models, each person that enters the program, the head of household and their members, they're going to have a lease for the apartment that they're living in. That lease has to be at least 1 year. And then within that lease, it has to be renewable for at least 1 month at a time. So here, HUD just wants to make sure that people have some permanency and some tenancy. So those are some of the basic requirements and features of permanent housing. Let's go next slide and we'll dig more into permanent supportive housing. So permanent supportive housing, or PSH, is a model that's been around for a very long time and it is ever evolving. PSH is long-term assistance for people who have a disability, a documented disability, who are experiencing homelessness per HUD's definition. And it includes typically robust supportive services to meet people where they're at, whether it's someone who has a substance use issue, if someone has a mental illness diagnosis, whatever the disability is that they're coming with, there would be a robust array of supportive services to help them get the apartment, settle in the apartment, and then maintain the apartment. So under PSH, one person in the household has to have, again, a documented disability per HUD's definition that we'll go over later. Next slide, we'll talk a little bit about rapid rehousing. So rapid rehousing, it is a 24-month or up to a 24-month intervention that HUD offers. It doesn't have to be 24 months, but it can be up to that. So the first question people usually ask is, well, 24 months doesn't sound like permanent housing, but the rapid rehousing model is meant to provide a bridge to help people stabilize, get an apartment, keep an apartment, get services and connections through your teams. And then the goal is that they stay in that apartment. They take the lease as they move forward. Rapid rehousing also is required and typically has supportive services. Again, meeting the people where they're at to maintain and their permanent housing. And then it's important to know, and I'm going to point you to your local CoC standards, but it's important to know that recently in 2017, 18, and 19, HUD made some changes to the rapid rehousing model about who could be served. And we will talk about later what those differences are, but it's always important to know, like, watch the notice of funding availability for each of these permanent housing types to see who HUD says is eligible in any given year. So again, we'll talk a lot more about eligibility, but for rapid rehousing, just wanted to highlight it changes a little bit, and it's changed a lot in the past couple years. So just keep your eye on that. So those are the two permanent housing types. We'll go to the next slide. There's also an allowance in the rule for transitional housing. Transitional housing is also up to 24 months. It also has to have a lease, but it could also have an occupancy agreement, which would give a person tenancy rights, just in a different format. Transitional housing is usually more service intensive than a rapid rehousing model. And it's important to know that right now, HUD isn't funding standalone transitional housing. They are doing it in a different way, but the transitional housing component can be I rent the apartment for someone, you rent the apartment for them, and then sublease it. There's a lot more flexibility in the transitional housing model. So know that it's allowed. And we're going to talk about, I think, in the next slide, how HUD is allowing it. Go next slide. Here we go. So I talked about transitional housing. I talked about rapid rehousing. So HUD, like I said, right now is not funding standalone transitional housing, but they did create a new component called Joint THRH, Joint Transitional Housing Rapid Rehousing Programs. What this does is it combines the two models together under a single project so that people can enter the project. They need and choose transitional housing, they can go that route. They need and choose rapid, they can go that route. Or they might go to transitional for 3 months and then move to rapid rehousing. It offers a little bit of a continuum within a project model to help, once you get to know folks better, meet their needs the best way possible. If you're thinking about this model or you already have this model, one of the requirements that HUD did put in is that if you're doing this model, you must be able to offer rapid rehousing for everybody that's in a transitional bed. So you can't tell people you can only be in the transitional portion. There has to be a path for them to move to the rapid rehousing portion. And some of that's budget management, timing, um, again, self-selection. So even though these two are combined, they can still do all of the things that I talked about on the previous two slides. So you'd have supportive services, you'd have some type of a housing assistance, and we'll talk a little bit in the next session about what those budget line items are. But you have all the same features of if it was a standalone, they're just combined to give you a little bit more flexibility to meet people where they're at, and serve parts of your community that maybe don't have a large shelter presence, or the shelter beds are very limited because there's such high demand. So just helps you quickly move people out of homelessness and into a project. Okay, we'll do next slide. So here I talked a little bit about what some of the considerations were already. As a CoC, one of the challenges when HUD creates a new program design is that you have to figure out what your community wants to do with this program design. So again, I would point you to the CoC as you design standards for this type of housing. You might want to put some boundaries around when it's used for subpopulation. You might have lengths of stay that make sense for your specific community. But again, no matter what you do in your own written standards at the continuum of care level, you can't tell people within the project that you have to stay in transitional for this long or that you have to stay in rapid. You really have to allow that flow based on the person's choices of where they want to live and how they want to be served. Okay, next slide. SSO only, we're not going to spend a lot of time on this because again, HUD is not funding a lot of these. In your community right now, typically the SSO, which is supportive services only, is probably only your coordinated entry grant that your CoC applies for to support the intake and organization at the front door of the crisis response system. But no, it is an option. Maybe some year it'll come back. But for right now, SSO is typically just your coordinated entry. And a lot of what we're talking about today does not apply to them. So know that it's there, keep your eye on it, but we're not going to spend a lot of time on that today. Next slide. HMIS, again, this is something we're not going to spend a lot of time on, but it's important to know as you're designing your projects that HMIS, which is the Homeless Management Information System, is a required piece of data collection software that each CoC purchases, and all projects funded through the Continuum of Care program and the ESG, the Emergency Solutions Grant, have to enter their data. If you're a DV provider, you'll have or a VSP, a victim service provider, you will have a comparable database. So I just wanted to touch on this because the homeless management information systems, you might have a budget line item that helps you support this. But I just wanted you to know it was an option that you could build into your project design, but it's not something that you are required to build in, but you are required to give data. So it's just something to think about as you apply for new projects and modify your existing projects. We'll go next slide. So again, very quick, this could be its own 90-minute session, but just wanted to give you an overview of the project types. And here on this slide, and you will get the slides posted and sent to you, this is just some resources on the HUD Exchange that will dig more deeply into the topics that I just talked about, give you some more focused resources. So that is it for project components. So we'll do next slide. And we are going to dive into some definitions and eligibility criteria. Do next slide. Okay, so as you just heard, there's a lot of project types. Most of the eligibility criteria globally applies to projects, but in different ways. So let's go to the next slide. The first thing that we're going to talk about is the homeless definition and the eligibility factors that go with that homeless definition. So HUD has 4 categories of homelessness, and we're going to go into each one of those. This chart just gives you a really quick overview of per the regulation, and I say that very clearly, per the regulation that HUD has right now as an interim regulation posted, this is who can use each of those project types. This is a good chart to pull out of the slide deck, put however you want electronically, or if you have a corkboard, however you keep your material. This is a good handy reference that you want to think about. My disclaimer is always HUD during your notice of funding availability in your annual application can limit or expand who can be served in which project type. So this is what it is today. And going forward, just continue to watch that annual application. So let's go to the next slide, and we're going to dig into each of these categories a little more deeply. So next slide. Okay, category 1. This is the most, I think, known portion of the homeless definition. Category 1 to HUD is called literal homelessness. So category 1 is your emergency shelter beds. It's people living in places not meant for human habitation. It's people that are leaving an institution, but right before they enter that institution, they were in a shelter or living in a place not meant for human habitation, which would be streets. It could be abandoned buildings, encampments, those types of things. So category 1, all projects can serve people who are experiencing literal homelessness, as it's defined by HUD. We'll go to the next one. Category 2, HUD calls imminent risk of homelessness. So imminent risk, as HUD defines it for the CoC program, means that someone will lose their primary nighttime residence within 14 days, has no other residence to go to, and lacks the resources and support networks to get their next permanent housing placement. As an example here, I like to bring my family members into this to say, like, if my brother has an apartment, but he has 2 weeks before he can get into his next apartment, he's not going to qualify as category 2, right? Imminent risk, because he has a place to go. If someone was evicted from their apartment and they don't have a place to go and they meet these 3 criteria, then they might qualify as category 2. So it's really important to look at this as a 3-part definition, not just will lose their residence within 14 days. Right now, not a lot of projects serve category 2 people that qualify under this definition. Again, you can refer to your rapid rehousing standards at your CoC level. And we talked about coordinated entry earlier. coordinated entry, as you all know, if you already have a project, they are the new gatekeepers and referral source for all project openings. So who you get at the project level is dependent on what your community decides are priorities at the coordinated entry level. So all these definitions apply to you at the project level, but it's more for you to be able to apply them to referrals that you are getting, not for you to go out and seek out people that are in these categories. Okay, we'll go next slide. Category 3. So I need to put it on here because it's real, but I deleted the definition because it's not applicable to us right now. There's no CoC in the nation that I know of that is allowed to use this definition yet. In the regulation, there's a way to become a high performing community. It's a very high bar, and then maybe you would open up some of your funds, but it's here. But I did not put it on the screen because I do not want to tempt you with it because you can't use it right now for any of your project beds. So we'll go to the next slide. Category 4 is fleeing or attempting to flee violence. This can include domestic violence, dating violence, sexual assault, stalking, or other dangerous or life-threatening conditions related to violence. Also having nowhere to go and also lacking the support network. This was expanded, I believe, also about 4 years ago. HUD expanded this beyond the traditional like domestic violence definition that you may have all been familiar with. They've been very clear and they have really good materials posted about this is the larger definition of fleeing violence that includes the items that you see on this screen. So it's just really important to know about that definition shift. Category 4 typically, again, can be served by most projects. Again, here it's based on your coordinated entry standards and how you're triaging and helping people that are trying to escape an unsafe situation. We'll go next slide. Okay, so that was the homeless definition. Now I'm going to talk a little bit about the disability definition. So we'll go next slide. Thank you. The disability definition, this really applies to permanent supportive housing, those PSH programs. But I like everyone to hear it because if you're a rapid rehousing program and someone might need permanent supportive housing later, it's important for you to understand this definition so that you can help people gather whatever documentation they need in case they need a bridge to the next intervention if they can't afford the rent or need extra help beyond what your project can do. So HUD's definition of disability includes people that have a physical, mental, or emotional impairment. It also includes people with developmental disabilities, and it includes people with HIV/AIDS. A common question that we get is, do you need to recertify disability? And the answer is no. So disability is only verified at project entry. You don't have to make someone get new qualifying paperwork every year when you serve them about what their disability is. And the reason people are confused here is because in your data collection, you might, once you get to know somebody, find out they have multiple disabilities that they didn't talk about in the beginning because you were building your relationship. So, on a data point of view, you might report additional disabilities that meet these criteria, but you do not have to get people to redocument them. So, it's just really, really important. It's only at intake. Okay, next slide. We'll dive a little deeper into what each of those categories means to HUD. A physical, mental, and emotional impairment that's caused by alcohol or drug abuse, post-traumatic stress, or brain injury. And again, it's a 3-part definition, is expected to be long, continuing, and indefinite duration. And it substantially impedes the person's ability to live independently and could be improved by more suitable housing. So it is a 3-part test. The last part, of course, everyone, right, can do better when they have stable housing, but it's really important in the documentation and the form that you use locally that providers are signing off on that all 3 of those things are present for the person that needs to enter the permanent supportive housing program. Next slide. HIV/AIDS criteria. So it could be people who have the disease of AIDS, or it could be any condition arising from AIDS or including an infection with HIV. So it's a little different. You can see this is not a 3-part test. This is just having the condition. It is not meeting a 3-part test. So it's only one criteria, not 3. Next slide. I'm not going to go through the full developmental disability definition. You probably have on the ground an agency that certifies people who have developmental or intellectual disabilities. So Jody, if you just want to go kind of next slide through this, you can see it's a very long definition. Go next slide. So I'll let you read that on your own, but those are the 3 categories of disability that HUD allows as qualifying disability types for their projects. Okay, now let's talk about chronic homelessness, everybody's favorite topic. Chronic homelessness was created back in 2015, 2016. I think we heard about in 15. It was implemented in 16. So HUD's expectation for the chronic homeless definition is pre-January 15th, 2016, people who were admitted to your PSH program met the definition that was in place before that, and anyone that was housed already as of that date. And then post that date, everybody going forward, if you promised HUD chronically homeless beds, then that is who you had to admit. It's important, again, this is a slide that should also kind of you tuck away in your resource pile, because as you're auditing your own program and as your recipient, if you're a subrecipient, is auditing you, people who are in PSH could stay 20 years. And in 10 years, are you going to remember what the homeless definition was? So it's really important for you to know this deadline so that you know, like, okay, if it was someone in 2015, I have to look at an old homeless definition. And if it was past this date, then I'm looking for the new definition. So again, just something to keep in your back pocket. I think it's really helpful to have this. I look it up at least a couple times a year. So next slide. Okay, so before we go into the actual chronic homeless definition, I just wanted to see where everybody was. So Jody, if you could open up the quiz, that would be great. So I can see kind of where people's experience is with chronic homeless definition. And then I will go more deeply into the definition and how to document it. Okay, so here on the screen, you can see a quiz has popped up. There are 4 questions. The first is, do people have to be homeless for 12 months or 365 days? So go ahead and select some answers for that. Jody's going to be watching in the background. The second question is, under the chronic homeless definition, there's this thing called a break. Is a break defined as 7 days, 14 days, or 90 days? Third question is more of a statement, so it's probably a true false. Institution stays never count as a month of homelessness. So go ahead and select your answer for that. And the fourth question is, staff who have had daily contact with a person who is experiencing homelessness counts as third-party documentation. So go ahead and look at those questions, put in your answer. Jody's going to watch to see when the answers start slowing down, and then she will close that up and show us the results. And because this is, it's a pre-quiz, don't worry about it. Just take your best guess. So you can participate even if you don't know what the chronic homeless definition is yet. Okay. So I see the results are published. And what I see is, do people have to be homeless for 12 months or 365 days? The correct answer is 12 months. There's a lot of confusion about this when the definition first came out, and HUD has clarified that. So we'll go over that and I'll give you some visuals for that. The second question was, is a break defined as 7 days, 14 days, or 90 days? And the answer is 7 days. Okay. The third, institution stays never count as a month of homelessness. The answer is false, because sometimes if you're in a homeless situation before you went into the institution, it may still count towards your chronic homeless number of months that you need to do. And then the fourth question was a trick question. So let's see how we did. Staff who have had daily contact with a person who's experiencing homelessness count as third-party documentation. And the answer is maybe. So again, I'll go into more about that, but maybe because if I have contact and I'm not the outreach person, I can't certify where someone's living, right? So it's maybe, it just says it's a staff person. It doesn't say what type of staff person, outreach worker or front office, right? Greeter or outreach worker or social worker. So that was a trick question. It's a maybe. You're going to need more details there. So okay, we'll go to next slide. Let's jump into the chronic homeless definition. Okay, again, federal regulations. It's another nice long definition. So we have the final definition of chronic homelessness. And this is a homeless individual with a disability who lives in a place not meant for human habitation, a safe haven, or an emergency shelter. You'll recognize that as the literally homeless definition for category 1. And has been homeless as described, so literally homeless, for continuously for at least 12 months or on 4 separate occasions in the last 3 years, where the combined occasions equal 12 months. So a little bit of math to do there. Or here's one of the questions we had, an individual who's residing in an institution who is there for fewer than 90 days, but was literally homeless before they came in. So if someone is on the streets for 2 years and they go into an institution of any sort for a month, they don't lose their status. And then the last piece, the or is or a family with an adult head of household who meets all the criteria. So HUD added that to be super clear that it's not just individuals. Individuals and multi-person households can qualify for chronically homeless beds. Next slide. Okay. Go next slide again. So Dedicated Plus is something that was created to help communities that were solving chronic homelessness or had fewer people who were experiencing chronic homelessness, as well as your friends in rural areas who don't have as much chronic homelessness. So HUD created something called Dedicated Plus, again, a long definition, to be able to serve people within the community who maybe have been homeless for a very long time, but aren't chronic, right? Because that definition was very specific. So to be dedicated plus, which again, this is a little jargony, but we can point you to resources. Dedicated plus is everyone I talked about who met the chronic homeless definition that we just reviewed. It's anyone, if you had transitional housing that's being closed in your community, it was eliminated during your competition, then those people might qualify for dedicated plus bed. HUD added the joint THRH folks. So people in those in that project may not meet the chronic homeless definition, but they may be eligible for a dedicated plus bed if one has been designated for your community. Also, of course, people that are living in literal homelessness, shelter and streets, who maybe aren't quite there for the definition of homelessness, but they had a permanent housing placement and then they were unable to maintain it and they fell back in. So they kind of lost that history of homelessness because they had a housing placement that didn't quite work out. And then they went back to a literal homeless situation. They may qualify for any dedicated plus beds you have. And then people who haven't had the 12 months or haven't had the number of episodes. So they've had 12 months of homelessness, but they haven't had the occasions, right? The 4 occasions separated by breaks and 7 days and lots of counting. So HUD created Dedicated Plus to just help open the door a little more because they were missing people who really needed PSH programs. But again, right, coordinated entry, you all as a community have standards that you've created. So coordinated entry is ultimately the decider of who gets referred to programs. Your job on the project side is, if they referred someone to you, is to know what you put in your project application. And then if you are a dedicated plus program, then which of these are you trying to document so that your eligibility paperwork is very clear? So there's a lot of different places that you're going to want to look, starting with your project application, to figure out, of all the definitions I just threw at you, who are you? What is your project? What was the intent of what you promised your CoC and HUD that you would do within your community? Go next slide. The last piece of Dedicated Plus is people that are in current Department of Veterans Affairs, the VA, homeless assistance programs, and met one of the above criteria at initial intake. So the VA has a wide array of homeless interventions. And anybody that is in those beds currently and met one of the criteria on the previous slide, they maintain their eligibility if they're in a VA homeless assistance program. And there's a whole memo on that also, which we can get to you. Okay, next slide. Okay, we are going to pause there. We've been on the call for about 40 minutes. We're going to talk about documentation next. But I think, Jody, we're going to take want to do a 10-minute break just so people can stretch and think about any questions they have. Pop them in the Q&A if you haven't already.
Great. We'll return at 2:47.
Okay, great. See everybody in 10 minutes. Okay, I hope everybody was able to go take a quick bio break, stretch, walk around. It's a lot of information that we talked about in the first half of the training. Now we're going to go into the documentation piece of it. And some people, this is how do I apply the definition, right, to my project files? That's what we're going to be talking about for the rest of the session before we go into grievance and appeal descriptions. So again, disability documentation, this is required for PSH programs, but it's good information for everyone to have. So we'll go next slide. So disability documentation, to support the definition that HUD establishes, it has to be from a third party, and it has to be documented by a professional who's licensed in the state that your project is in to diagnose and treat that condition. Or if someone has made it through the benefits process and got a favorable award, if they have SSI or SSDI, the federal government has already helped us with this, and that is documented there. You would just need to know the category of how they qualified so that you could put it in your file and in your data system. So it has to be third party, and it has to be by a professional who's can treat people and make that diagnosis in your state. And I'll give you an example about why I emphasize that so much. When I was working in the state of Maine, I had a few files come through where a substance abuse counselor who could definitely diagnose people with substance use disorder but they were certifying people who had a mental illness, which was beyond the scope of their license. So it's just important to make sure that you're aware, like you can just ask the person, like, what's your specialty? What are you, allowed to diagnose in this state? Or ask your clinical director if you have one. So it's really important to know that it has to pass that test of third party and it's within their licensure to make that decision and that diagnosis. So next slide. I include this because it's in the rule, so I have to talk about it, but I highly recommend that you do not use this option often or at all in your PSH program. So HUD does allow intake staff observations. So if there isn't third-party verification available at the time of project entry, you can use your intake staff observations, but it has to be confirmed in writing by the third party I just talked about on the previous slide, no later than 45 days from the initial intake, which is typically the project start date, which the project start date is when you define them as eligible for your project. So that is a big risk to take, because if you take someone in the project, have them do housing search, find an apartment, possibly, if the third party documentation does not come, you cannot get reimbursed. So it's very important to know that this is an option, but it is not a good program design unless it is used very scarcely. Like, the doctor's out of town, they'll be back tomorrow, and we know they're an established patient. So you can have policies around this, but I would be very cautious with them because your billing will stop if it's not there within the 45th day. There are no exceptions for disability documentation to be self-certification. We'll talk a lot about this under homeless documentation, but for disability, there just isn't an allowance for that. And then just a quick reminder again that developmental disability and HIV/AIDS are not required to do the 3-part test. So it's not the and definition, it's just meeting the definition as it's stated in the rule. Okay, next slide. For people who have PSH chronic beds that you've promised HUD, I will serve people who are chronically homeless in my permanent supportive housing beds. It's important to note that HUD has limited that the person applying, the person that's qualifying for the bed, it has to be the adult. So you can't have the child have the disability if they're not the head of household. So if you have a PSH with chronic homeless applicants, the adult has to be the one with the documented disability. The only time it could be a minor is if there's no adults present. But again, that doesn't happen often in PSH design. It's not impossible, but it's unlikely. So just know there's that additional criteria for disability documentation if your PSH beds are dedicated to serve people who are chronically homeless, which is very common in all CoCs nowadays. Okay, next slide. Okay, now we're going to talk about homeless documentation. At face value, it seems pretty easy, right? On CoC programs, you have to be homeless, and for PSH, you have to have a disability. There's actually only 2 things, yet this is the #1 monitoring finding. Go to the next slide. The #1 monitoring finding is HUD cannot tell when they're looking at charts that people were homeless when they came into the project. This happens for a bunch of reasons. Can you go back one, Jody? No, other way. This happens for a bunch of reasons, and it really starts at your administrative organizational team structure level. So you have to have policies about how you're going to help people document their homelessness, and then how you're going to keep that homeless documentation in your files. Please, please, please never shred it. Again, everything I say to you as examples are things I've unfortunately seen in the field. So get your homeless documentation and keep your homeless documentation. So your policies have to say when you're going to gather it, what it's going to look like, where you're going to keep it. You also have to have policies around showing that your referrals are coming from coordinated entry and that you're not going around the system, right? You have to go with the system. and that you're in alignment with your CoC written standards. So we're going to dig much more deeply into all of this. So let's go to the next slide. Okay, so documentation review. The reason people get this wrong so often is when you're talking to someone, it's an experience, right? Like someone doesn't come to my door and everything works itself out in 24 hours. Bringing someone into a project, building a relationship takes time. So you're reviewing someone's homeless status per this HUD definition at referral, right? You're going to coordinate entry is going to work off of what they have. They're going to say, hey, this is Melanie. We believe she's homeless. We believe she'll qualify for your project. You're going to go get the referral. You're going to meet me. You're going to ask me. I'm going to tell you what's going on. That's another time we're going to talk about my homeless status. But the one that counts is the last one. So at project entry, that is when the documentation has to be super clear that I am experiencing homelessness that counts for this type of project that I'm running at my project entry date. And project entry is when you say, okay, Melanie, you're eligible. Let's go find you a unit, or you're eligible. We're starting services. So it's really important that even though you've talked about it maybe for months, that at the project entry, you step back, you document what needs to be there. And because, especially if you're serving people who are chronically homeless, there's not a lot of paperwork. You're putting together someone's life history that was very traumatic. So you need to make sure that your look back period, if you're doing that episodic chronic homelessness, is from the project start date back, right? Like if you start gathering documents and it's 3 months later, it's important to go back and make sure all the dates still work. So the next slides are going to be pretty dense and we're going to go through them pretty quickly, but you're going to have them as a reference. I just wanted to give you some visuals on how you're actually going to get this done and some basic rules that you're going to apply to everything that you're looking at that you think is the homeless documentation. So let's go to the next slide. HUD has a really great training about this online also. So that link is going to be in these materials, and everybody in your project should do it that's touching the verification of eligibility for the people that are coming into your project. So basically, this is what HUD wants to see, and this is what they're not seeing in many project charts. They want to know who's providing the information, not just Melanie, but Melanie that works for ABC Shelter, right? Like tell them why I'm the qualified party. The second is they want to know who it's about. So don't say it's about George, say it's about George Smith, right? Like name the person who's then going to match the file that you have. If someone goes by an alias, decode that. The third is provide sufficient detail regarding what you're trying to document. So as an example of this would be, don't say Melanie is homeless in Sacramento. That's not enough. I don't know who's telling me this. Which Melanie is it? And homeless means a lot of things. Which type of homeless, which of those categories am I experiencing at this moment that you're going to make me eligible for your project? So these are the 3 rules to keep in mind, and everything else we're going to talk about flows off of these. Next slide. Okay, these are from that HUD training that I was talking about. I stole some of their screens. They were really good. They're super clear. So this first slide, you can just see like who the person is. So if this was just signed Mary Jones, I don't know who Mary Jones is. You might know who she is, but in 5 years, whoever's giving that chart to HUD, they might not know Mary Jones. She might not be there anymore. So if you're going to have an email or a letter, it should say their title and the agency they work for. That's how HUD will know this is a street outreach worker. That's why it's okay. It's not the clinical director who doesn't, do direct services anymore. Next slide. This is an example of naming the applicant. So this is John Rogers. If John goes as Bob, if everyone knows him as Bob, but his name is John, right? You'll want to like tie those 2 things together. So very clearly in this email, it is named like this is the person. And then we already talked about Mary Jones is the one providing the information. The next slide will tell us where they're living. So you can see this is really detailed. This person's in an encampment behind a closed factory, what type of assistance they were getting, and the date that they were getting that assistance. So this is an example of good homeless documentation, and it's short. The other mistake people make is they have reams of information. I was just doing a monitoring for someone, and the homeless documentation was like 18 pages, and none of it said the right thing. It was all there, but it wasn't clear. So more is not always better. It's just being clear and concise with that final document that you're going to keep as your documentation of that this person was eligible. Let's go next slide. So we talked a little bit about third party, and this is HUD's preferred order of documentation. So they give you allowances to go to self-certification if you need to, but they expect you to first try and get third-party documentation, which means directly from the source of the person who is with the person experiencing the homelessness. The second option, if you can't get third party, the shelter just won't respond to you. They don't have an outreach worker, so there's no one that's directly been working with them in an encampment, is you could do intake worker observations. If someone comes to you and, obviously they're sleeping in their car, you can see the car, you can see all their stuff in it. If it's someone that you have a relationship with in your intake role, that may be a way you can document homelessness. If none of those are available, then you could go to certification from the person. If you don't use number one, third party, you have to document your due diligence. This again is where people are they're doing the work and they're not getting credit for it because they don't write it down. If the shelter's not calling you back, if you have the person self-certify that they're homeless, write down in your case notes, your intake document, wherever you keep this, I called the shelter 4 times. Their fax machine is broken. They can't send me the information. Whatever the reason is, you have to show that you tried third party and an intake worker before you go to self-certification. So it's allowed, but it just depends on what the circumstances are. Also, there's no one answer for like, what does homeless documentation look like? From a shelter, it's going to be different than someone who was in the hospital who was in a shelter before. So we'll go to the next slide. In the manual that Stacy was talking about, there's going to be a lot more information about this. But it's just, it's important to know that it's really going to vary by the person that's coming into the program. So if you have third party, again, refer back to the email example that HUD had. It needs to show like who it's from. So if it's a letter, it would be the letterhead of the agency. If it's an email, it'd be that signature line. If it's a form, it should say which agency it's coming from. So if it's coming from the shelter, they should put their name on there as the person that's providing the information. And then again, what some people run into is lots of signatures, but I can't tell who the name is. So even if Bob is the outreach worker, I can't read Bob's signature to figure out it's Bob and then explain the story to my monitors when they come. So if you have a lot of people that don't have legible signatures, go ahead and add a print name line to whatever form you're using. So, and you'll see this multiple times throughout the slides. Make sure that you're not jeopardizing anyone's safety. So you're not going to say, can you please call your abuser and like, get documentation. You're not going to have people go back into unsafe situations. That is where you would move right to self-certification, most likely. Okay, next slide. Here are some examples. I already gave some of these. This is more for your reference as you're going forward, as you're training your own staff. But these are just examples of third party that you can take back as you're doing your team trainings and think about like how this applies to your community. Okay, next slide. Okay, oral verification. It could be that you're on the phone with the shelter, all the technology's down, you're in a disaster area, whatever the situation is. You can write it down for someone, right? If you're like, I'm on the phone with Melanie, she works at the shelter, just document what is going on and why you're doing it that way. This is just a way to kind of move forward without having people remain homelessness because we're waiting for some paper to exchange. So it's okay to call people and get that oral verification. If this is all you do, HUD might get a little leery of it, but it is available as an option to you as you move through a very complicated homeless response system. Okay, next slide. Okay, here you go. Here's an example of, again, some documentation situations. The third party, it has to be a person who's physically observed the person. So this was that trick question we had. It has to be the outreach worker. It has to be the caseworker who goes out to meet people. It can't be self-report. So it wouldn't necessarily be someone who's working at a food pantry or a different service option within the community. Written observation, this again would be by the intake person or the intake worker or whoever's doing that role. They are the ones that would document that, but they're not third party because they're not looking at the situation. They're not living that with the person. And here I just put some examples about how this you might put together someone's history and what each one would be like. So again, more for you to bring back as training tools as you bring your team up to speed. Okay, next slide. Okay, next slide again. Or maybe just, well, there we go. So for institutional stays, you go one more. You can have the discharge paperwork from the institution. So you would have two things. You'd have the institution paperwork and you would have whatever the literally homeless documents were. So if someone's in the shelter and then they went to the hospital, you'd have the hospital and the shelter letter together. And again, it has to be less than 90 days, not 90 days or less than 90 days. So 89 days and less. Next slide. Self-certification, I talked about a little bit. It's totally okay. People can tell you their situation. You can write it down for them. They can write it down. You can help them. You can have a form. You can do it on a piece of paper as long as it's legible and clear. But again, as the worker, the staff in the project, you have to show your due diligence that you tried to get third party. So whether it's on that same form where you have self-certification or in your intake notes that are kept with your eligibility documentation, it's really important that you make sure you're documenting your due diligence. So next slide. Due diligence, again, is reasonable attempts, but don't put people's safety in jeopardy. So don't reveal a location accidentally. Don't make people unsafe, but do what you can to get people's third-party documentation. HMIS can be your friend here. If your shelters are all using HMIS, then you might just be able to look in HMIS and see if I meet the literal homeless definition. You might be able to put together my chronic homeless history. So even looking in HMIS might help you here. So it's really important that you document what you've tried and if it didn't work, why, and then moving on to the next, like self-certification is your likely next step. Next slide. Okay, just kind of went over this. Just gives you some more details, date, time, outcome, happened, didn't happen, obstacles, and then signed. So again, just as you're putting together your policies, this is the type of thing that you want to look at to keep in your policy so that everybody knows what to do and what due diligence means. Next. Okay, category 2. Here again, I just gave you a list of possible situations that might be category 2 and some ways that people have documented them that HUD has accepted in the past. So you have 14 days losing rental housing, that would be the court eviction. A hotel motel that's self-paid, you just have to show that the person can't maintain that hotel. A housing that you're maybe staying at a cousin's and you're being moved out or they're being moved out, then that is something that you could do. Again, no subsequent housing and no other support networks. So the trick with the category 2, if your community prioritizes this population, is can you move quickly enough to have valid documentation from by the time that you have a project opening? Because sometimes those things don't line up. And go next slide. Category 4, it's important to note here that victim service providers have different documentation standards than a non-victim service provider. So if you have a DV program, they can do that self-certification. They can write that up for the person, no problem. If you're not a victim service provider, you just want to document that the third-party documentation is not safe, and then people can do self-certification. So it's a little bit different depending on which hat that you're wearing. And again, I went over this is more than just our classic domestic violence that we all learned back in the 90s. This is a much larger definition. HUD is very clear that it's many different situations. Next slide. Okay, go one more. Okay, let's do a quick quiz about project start date. I said a little bit about it earlier, but again, this is one of the places that people make the biggest mistakes. So Jody's going to launch the poll, and I just want to see what people think the project start date is. So the question is, which of the following dates should you use as your project start date? Give about 15-30 seconds to answer that. Okay. Let's see what people said. Okay, so the choices were date of project acceptance, date first house, coordinated entry referral, date of project acceptance approval. Sorry, we just had that one twice. And date of project intake. So the 22% and the 11%. The start date is the date of project acceptance and approval. So anybody who chose that, the 9 people that chose that, that is the official HUD project start date. All PSH and I think rapid programs have a project start date, which is when the person was eligible, got services, started their housing search. They also then have a housing date, right? The date they first got the keys to their apartment. So there are 2 dates to manage, and HUD is going to look at the project start date and the eligibility documentation that matches the project start date. So it's really important that you enter those and document those clearly. Otherwise, if you use the date first housed, your eligibility documentation is probably not going to cut it. It's going to look like it's too old and doesn't qualify the person. Go next slide. So chronic homelessness, the reason I spent so much time on homeless status and disability status is because both of those come together, and that is how you document chronic homelessness. So we're going to go next slide because I have some visuals to talk about with chronic homeless. So again, we talked about chronic homelessness is literal homelessness, that category 1. The second half of the screen on the right side, single encounter in a month is sufficient to document the whole month, unless there's evidence right in front of you that there was a break. So if I was in a shelter and then living in an encampment, as long as there's not evidence of a break, the person's not telling me, that single encounter at the shelter can document your entire month of October. I have a visual on this, so let's go next slide. And one more. There we go. So 12 months continuous. This is a list of places where you might be able to get that: HMIS records, shelters, outreach workers, institutions, self-certification. Next slide. It's going to look a little repetitive. This is the visual. Okay. 12 months continuous. So you can see here, if this is what my person who was coming into my program, if this is what their paperwork looked like, this equals 12 months of homelessness. Check, they're eligible. I can give them a letter, tell them they're eligible, and have a project start date. But you can see, some months it's all the days, some months it's one of the days. So HUD has a really good form. It's tedious, but it does the job on how to document chronic homelessness, and a chart that you can fill out so you can double check the reams of paperwork that you get when you're trying to get this eligibility documentation done. Next slide. So episodic, same list, right? HMIS records, shelters, talking to the applicant, being like, where were you? Who could we call? Outreach workers, same thing. It's a different way that you have to document that they were 12 months over the last 3 years with 4 breaks, but the sources are the same. Go next slide. So here again is a visual of what someone could look like. And you can see here I have referred on May 4th, admitted on June 1st. So it can take a really long time to put together someone's history within a very fragmented, homeless response system, especially if they've moved geographies. Next slide. Again, don't forget HMIS. The only thing you can't use out of HMIS is the self-reported information. So if your HMIS allows for me to say, I was at XYZ shelter in XYZ city, then that doesn't count as third party. It's just the information that the shelters and the outreach workers are directly entering. So if you look in your HMIS system, there should be like project entry, enrollment, exits. That's the type of information. It's not the self-report. So I just wanted to kind of highlight that. Next slide. Okay. We're not going to do the poll, and we've already looked at this slide. So I'll let people think about it for a second, and I'll give you the answer. How many months of homelessness does this email that we've looked at in 3 different ways? So this is the 4th view of it. How many months of homelessness do you think this documents? Okay. So the answer is 2. And the answer is 2 because you can clearly see it's February, right? At least one day in February, and it says since February. It was also written on March 1st. So they are still homeless because it says, right, the way they wrote it, it says that he's still staying there, not stayed. So this is 2 months of homelessness. This counts for February and March. That's the kind of lens that you want to look at your documentation through. And then again, you can have your own form, or you can use the HUD provided sample form on how to like make sure you're counting to 12 the same way that HUD would be counting to 12. Okay, we'll do next slide. Breaks can be completely self-report. You're not going to have someone go and get a letter that says I stayed with my mom for a few days. 100% of the breaks completely self-report. Just have a form or a piece of paper. You can have third-party evidence, but you don't have to. This is something you can just document with the person that you're bringing into your project. Next slide. Yes, institution. Fewer than 90 days, not considered a break. So again, 89 days or less, those months still count if they were literally homeless prior to entering the day before, not the week before, the day before. Okay, next slide. Okay, let's do this quiz real quick and then we'll open for questions. So what is considered a break? Go ahead, Jody, we can launch this one. Oh, sorry, I skipped a quiz on you. Can close this one and launch the next one. That was me. I'm not seeing many questions in the Q&A, so I've either completely overwhelmed you or you're taking this in and we'll have lots of questions after. But if you're thinking about it, feel free to pop those in. Okay, so the question is, what is considered a break? Staying at a friend's house for 20 days, staying at a hotel for 2 nights where the person applying for your program is paying for it, staying at a hotel for 30 days, the local church is paying for it, staying in a shelter for 7 days of the month because you instead of living in your car for the whole month, or staying at a girlfriend's house for 15 days. Okay. Go ahead and put your answers in. And Jody, when you see it kind of start slowing down, we'll publish the results. And while people are doing that, I'm just going to call on audible that Stacy, let's do grievance and appeal in the next section. So we have time for questions on this. Okay, break. So staying at a friend's house for 20 days. Yes, that would be considered a break because it's over the 7 days. Staying at a hotel for 2 nights where the applicant pays for it, not a break. A break is 7 days. Hotel, church paid for 30 days, also not a break. Hotel being paid for by a third party social service type agency or community entity is not a break. Staying at the shelter for 7 days instead of living in your car, it's just a change of situation. It would also not be a break. Staying at your girlfriend's house for 15 nights, that would be a break. So it's really just A and B because you're over that 7-day mark. So next slide. Okay, dedicated plus. Here again, we talked about what the definition was. And the most important thing to know about dedicated plus is there's certain caps that come with being a dedicated plus bed versus a dedicated plus bed. And in your application, you tell HUD, I'm gonna have 20 beds, 10 of them will be dedicated. Depending on what you say, there's different caps that apply. So let's go to the next slide. If you have a dedicated bed, then you can only have up to 25% of people self-certify for more than 3 months. If you're not a dedicated bed, if you're dedicated plus without dedicated beds, then you can have more than 25% of households do more self-certification. Again, HUD doesn't want to see 100% of everybody doing self-certification. They're not going to believe you. But just be aware, if you have dedicated beds, you do have this cap of no more than 25% of the households you're serving can certify more than 3 months. So that means, right, I'm sorry, 25% can certify more than 3 months. So 75% can only do 3 months at a time. So it's just a technical piece that you really want to be aware of if you have dedicated beds, because you don't want to shut the door to self-certification, but you have more leeway with it if you don't have dedicated beds in your project. Next slide. Here, this next round of slides, again, it's reference more for you than it is things that I'm going to read to you on this webinar. I put in links to the FAQs, the frequently asked questions that HUD has published over the year to help people understand what Dedicated Plus is and how to use it and how to document it. So this talks about the documentation requirements and what you have to do and what you don't have to do. Next slide. So here again, I have a lot of information. I just wanted you to have it as reference. You can go next slide. These are things I find are hard to find answers, but things that come up quite often. So we'll go next slide. So PSH issues, people holding bed vacants if there's no chronically homeless person who's referred to them who wants their project. That is something at the coordinated entry level that you want to talk about. If you document that there's no one experiencing chronic homelessness, then you can move to the next person, and that is in your CoC standards. It doesn't happen often, but it does happen. Please do not admit people from transitional housing into a chronic homeless bed. People in transitional housing do not maintain their chronic homeless status. No exception. Rapid rehousing, saying blanketly, no, rapid rehousing participants can't come into my PSH. Not true. It depends on when they came in and what documentation, what they were experiencing. That's why it's really important for me to have rapid rehousing providers know the chronic homeless definition, because maybe you can document that and help people have that if they need to bridge to PSH. And then again, the due diligence, not getting credit for all the hard work that you're doing. Next slide. This is a policy that you'll have locally. So again, I'm going to give you the information and let you read that at your leisure and check it against your written standards. But just know it is possible. Again, it's a coordinated entry kind of protocol too. Like, great, I'm back on the priority list, but when do I come off the priority list? So just know it's possible. The local procedures will talk about how it happens and when. Next slide. Rapid as a bridge. I've talked about this a couple times. Some people in rapid rehousing may qualify for PSH. It depends on what they were experiencing the day their project start date, right? Back to the project start date. It depends on what they were experiencing at that project start date to depend on if they are eligible for a bridge. And of course, if coordinated entry is going to prioritize them. So there's a lot of coordinated entry policy that impacts your ability to enter and exit people at your project level. Next slide. This we kind of talked about a little bit. Again, written standards of if you solve chronic homelessness, how do you still keep those PSH beds open? So at a project level, you want your coordinated entry to say, I have no one else. You have to retain that documentation. You have to show that you've done outreach and that there really is no one that meets this. And then you move forward and do everything that we talked about to document regular homelessness. So This is something you can do, but you really want to be clear that the whole community agrees. And it's not just that you are unhappy with the coordinated entry project. That's not a reason to move forward without serving someone who's chronically homeless. Okay, next slide. This again is for your reference about people leaving households, what you can do. On people in PSH, you can stay through the expiration of your lease. If the remaining adult meets the project eligibility criteria, you might be able to transfer to them. Sometimes there's two people, like it could be me and my boyfriend. He has a disability and was homeless also, but we only need to document one of us. So it's just really important that you're helping people maintain housing whenever you can within these boundaries. Next slide. Again, I just wanted to provide the immigration status information to you so that you would have it. It's a little outside the scope of this training, but again, hard to find information, but often asked question. So next slide. Okay, so Stacy, I hope it's okay that we're going to cover this during the next session. We'll put it right at the beginning of the next session. But I did want to leave time for questions. So I closed my Q&A box, but I see there's a few numbers there. So are there questions that we want to answer in the last few minutes that we have together? I'm kind of looking through them. So the first question is, are we as a PSH project allowed to approve someone who is fleeing from their current housing due to domestic violence, but are not a current participant of HUD funds in our program and are not chronically homeless? Great question. We did give people the option to be anonymous. So I'm going to give you a very general answer. And then if you feel comfortable, I would definitely connect with Stacy and we can talk about this specifically. A PSH project has to get their referrals from coordinated entry. So my question would be, is coordinated entry prioritizing this person? Have you solved chronic homelessness? And is this the focus of your project? Is this the population that HUD funded you for? Right? So that's another factor here. So to answer this, I'd really have to look at your project application and your coordinated entry. So that's all I can say on that. So the other question I see still in the open is, can someone have 12 instances of homelessness in 3 years, even if during those 3 years they entered a transitional housing program? Oh, great question. So the transitional housing program time does not count as homelessness. So if they were in a transitional housing for a couple months within those 3 years and you still had 12 months, possibly, right? It could qualify. If they're in a transitional program for 2 years, it's less likely that they're going to qualify. So it's not being in the transitional that doesn't make them qualify. It's the length of time. You just might not have 12 months left, depending on how long that stay was. So transitional housing stay doesn't count as a month of homelessness. So it would be a break, right? They went into a housing arrangement. And then it's about counting the rest of it. And that's where, again, it's busy, but I really like the HUD form to help me count to 12 because it's HUD math, not our math. Stacy, were there other questions that I can help with that you haven't already answered?
I think that's all that I'm seeing in the chat, unless folks have other ones they want to add before we have to end.
And again, I know it's a lot of information. There's a lot of information there for you to reference afterwards. The key is to take it slow. Check your assumptions. It's really important that you're looking at your paperwork. And in my agency, before I came to TAC, we actually had our front office staff do our final proof because they weren't as invested in it as we were. They didn't know the person as well. And they're like, no, this doesn't tell the story you're telling me verbally. So sometimes someone that's a little farther away from the project can see the gap that you can't see because you're filling in the blanks, right? Because you have a relationship with this person. Okay, so to clarify, PSH can transfer to PSH. What are the conditions again? Sure, so it'll be in the slides, but I'll kind of briefly give you the answer. So PSH can transfer to other PSH if the person transferring meets the eligibility criteria of the project they're transferring to, right? So this is where when I said like a good reference slide is, when did chronic homeless definition go into effect? So if someone, right, depends on how long they've been there, what documentation they have. So they do have to provide the next PSH with the documentation. Because if someone goes from project A to B, project B is going to be monitored by HUD or your CoC, and they have to be able to show that. They can't say, oh, let me call project A, because there isn't a relationship there anymore. The second hurdle for PSH to PSH transfers are, what's your coordinated entry say? All transfers typically all openings have to go through PSH, coordinated entry. So unless you have a rule that says you can take PSH transfers not going through the priority list, you have to have a process to get them on the coordinated entry list and get them off, hopefully quickly and in a planful way. So if you have someone that has to go to another project, you should be talking about it during your case conferencing, talking about with coordinated entry ahead of time, talking with your CoC if you don't have a clear process, those types of things. So it's possible, but refer to the slide and then look at your written standards to see what your community decided PSH to PSH was going to be. Really great questions. I know we're at time, but if there's any last burning questions, I'm happy to take them. And again, you can always follow up with Stacy or other SSVF staff or SSF staff that you have a relationship with, and we can try and get you an answer if it's more project specific. So any last burning questions that people want to throw out there? Okay. Well, thank you so much for hanging in with us on a topic that's vitally important, but very dense and sometimes a little overwhelming. You've got this. Just go slow and careful and double check your work and reach out with any questions.
Thank you so much, Melanie. Appreciate your help and attention to detail. I will invite everyone to complete this brief survey with the QR code here. And if you don't have time to do it, there will be a link in a thank you email with the recorded content and a copy of the presentation. And please don't forget to register for the upcoming series as well. Thanks, everybody.
Thank you.